Hi everyone, I'm here at the Healthcare Payers Transformation Assembly in Dallas, Texas. I am here with Sue Powers, the Chief Growth Officer at VirtualHealth. Thank you so much for being here today.
Oh, thanks for having me. It's been a great event so far.
Good to hear. Yeah. So start from the beginning. Tell me a little bit about yourself and your company, VirtualHealth.
Sure, I'd love to. So, I've been at this company for 3 years. And previously, I've been at a variety of vendor companies in the healthcare space, selling technology, selling solutions into the healthcare space. Prior to that, I was actually came out of school as a computer science degree. So I ended up in the sales side after a number of years, and it's been quite the journey. But I like the approach because I understand the technology side as well as the selling side. So it gives me an interesting perspective. But from a virtual health perspective, I've been here for 3 years, as I mentioned, and I love the company, and I love the ability for our solution to make a difference. And what we provide is a platform for integrated value-based care. And what that really means is a platform that takes into account the whole person care, both the clinical side as well as the social determinants of health side, and tries to bring the entire care team, including the patient or the member, their caregivers, providers, and then the care managers, social workers, clinicians, all together at that virtual conference room table to collaborate and coordinate around care. And the goal is to improve efficiencies and productivity of the care team, while at the same time improving health outcomes at a lower cost.
That's great. So it's all encompassing. It's including everyone.
It does.
Very important.
It is. That's critical, because what happens now is there's a lot of silos of information, and people are not coordinated in the efforts, and it really causes inefficiencies as well as higher costs.
Right. So how does VirtualHealth collaborate with clients and partners to really transform healthcare, especially as we're at the start of 2019?
Right. So, the goal is to really focus in on that whole person care, and I think that's what everyone's talking about as well. So we're right at the right inflection point from our perspective of really being able to make that difference. So the way we work with clients is that we do have a solution, a platform that does this, but this platform can be tailored and configured specifically to their business. About 80% of our platform is configurable on the front end. So at the platform side, right, where our clients can be involved, as opposed to the back end where development has to be involved. So that's a key way that we work with our clients, is understand their business model, understand the functions and requirements they need, as well as their workflow and their business rules. Then we can tailor the platform and configure it appropriately on the front end that it fits them. We like to say fits them like a glove. Right? So it's kind of an interesting model where we view it as almost a hybrid between an off-the-shelf product and build it yourself. And that allows our clients, each one of them, to tailor it appropriately.
It's all about that buzzword, personalization.
It
That's
is
what it's about.
It is.
So from your vantage point in the industry, what is the biggest challenge that C-suites are really facing in healthcare?
Yeah. I really think that there's so many things for them to think about on a daily basis, right? There's lots of challenges that they're faced with, not only from the industry, but even, and on the industry side, from a lot of the acquisitions and mergers and things that are happening in the industry that can distract them from their mission, right? And their mission of making sure that people stay healthy. So I think that's a big issue for them. But the other issue that we see is that sometimes, because of those distractions, they don't move quickly. So there's a lot of, let's take a look, but don't necessarily move quickly. And I think that's an issue, because yes, you have to do the appropriate analysis, but you can't get paralyzed by that. And so in my way of thinking, the ability to be decisive, make those decisions, and then move forward quickly with them is really critical if we're going to move healthcare in the right direction.
Sure. So give us a little more insight into VirtualHealth and your approach in transformation.
Sure. So we think it's twofold, right? We have a great platform. It's really very intuitive, easy to use, and provides the functionality that our clients need to really get to that next level. But in addition to that, we have a great team. And I think it's a combination of the company as a whole and then the product and the solutions that they provide. And so we try to make sure that we have the best team out there that's collaborating with the client during that implementation work, but then afterwards, making sure that our team stays with them through the life of the contract. And our focus, and that's actually one of my teams. I have 2 teams. I have the sales side as well as what we call our client success team. And our client success team's mission is to make sure that each and every one of our clients is ecstatic to be part of our family and provide and gets great value from our solution. So I think it's that combination of the solution, of course, but also the team behind it, that not only during implementation but ongoing.
Makes a big difference. So throughout this industry, everyone has a lot of access to data sets, and it's becoming more and more so.
Right.
So how does Virtual Health support the industry by capturing intelligent data across the care management continuum?
Yes, that's a great question, and that's a key thing that we do. So the platform needs a lot of different data to be really useful, right? So we have an integration process that is part of our implementation stream that works with each of our clients to say, okay, what is the data that you need on this platform? What's going to make you successful? What's going to make the care team successful? And that data can be very disparate across membership, claims, EMR systems, community resource systems, labs, medications, et cetera. We have got this process that allows us to bring in this disparate data from whatever source it's in, whatever format it's in. And so we never ask our clients to change their formats and adhere to ours. We take that upon ourselves to map it, normalize it, and populate the platform appropriately. And what that allows us to do then is to take all of those disparate data sets, bring all that data to the platform where they're all unified. And now the entire care team has access to it.
So you mentioned before about all of the mergers that are happening now.
Yes.
So
Yes.
we've seen a number of major mergers in the last couple of years, I would say. And so
Right.
how are these shifts in the health ecosystem changing these data flows?
So I think they, at times, can complicate it. Because as companies merge, then they have to look at how do we bring all this disparate data together just for our own company. And so I think it gets a little bit complicated in trying to flesh out what's the right model, what's the right data that should be on the platform, and how do we make it all happen across a company that's now much bigger. So for all of those organizations that are doing that, I think that integration is a huge challenge and a bit of a barrier to get over as they try to take advantage of what that acquisition or merger is supposed to bring.
So we're very happy you're here at the Healthcare Payers Assembly,
Thank you.
and the Virtual Health team. I'm curious, now that you've been on site for a day and a half almost,
Yes.
what are some of the benefits that you're seeing of being here in this
Sure.
small setting of
Yes,
ours?
yes. Well, I actually love the way that this conference is run. So from my perspective, it's one of the most valuable ones that I go to. And the reason is a couplefold. One, it is intimate, right? There are not a huge number of folks, which does help. They're the right folks, the right decision makers from the different organizations who have come here. And we as a vendor, right, feel more like a partner here. And that's important. There are many conferences where you feel like a vendor. And that makes it challenging, right? Because we have to invest our money in the appropriate ways to get what we need out of everything that we're doing. This conference allows us to be a partner, to spend time with people who are interested, right, in what we're doing and what we have to talk about, as opposed to someone just coming by our booth to get a free something. Right. So from that perspective, it's really wonderful. And we can look at each and every one of our interactions here and determine, yes, that was a very successful interaction. Maybe not real short term, but longer term, because we build relationships here. So that's the value that I see.
Well, that's great to hear, and we hope to see you again soon. Thanks
you.
for being with us.
Thank you. I appreciate it.